Welcome, everyone. I know a bunch of you were in the last session that we hosted, so that's good. Good to see some faces again. Today we are doing naloxone training. We have our amazing pharmacist, Mark Barnes, who is the most perfect person who comes and does all of these for us. And I'm sure he's sick of me asking him to do things every day, but here we are.
Never.
Okay, Mark, you're up.
Hi, guys. My name is Mark Barnes. I'm a pharmacist and I guess an addiction treatment specialist pharmacist. So I've been doing this work and helping vulnerable communities for about 10 years now. So basically, I used to be that pharmacist at Shoppers Drug Mart with the white coat on who never looks at you when you walk in the door and you have to speak to 5 people before you talk to them. That was me for years and years and years, but now I'm actually not that guy anymore. I honestly just do addiction treatment. So we owned a pharmacy in Westboro in 2007 to 14. In 2012, I accidentally dispensed a fentanyl patch to a dying cancer patient who sold that pain patch full of opioids to a 19-year-old in Manitic who overdosed and died. So that was our first overdose of fentanyl in Ottawa. So I kind of felt responsible because the patch came from my pharmacy. So I said, this is enough of this. At that point, we had already been doing a lot of addiction treatment and I'm loving it. So then I said, that's it. I ain't going to prevent overdose forever. That's what I want to do in my future. So then we sold Westboro Pharmacy and I opened Respect RX Pharmacies, which is a pharmacy dedicated to the respectful approach to addiction treatment for clients. So we're an inner city type pharmacy with no big front store with all kinds of cosmetics and shampoos. Sorry, guys. But just we do clinical services and help out group homes, people battling addiction, downtown, in the inner city cores. We've grown now to actually have several locations. We have one in Cornwall, Bell's Corners, Vanier, the Bywood Market, soon Ottawa South and Kingston. So we have access to 2,000 people, or plus that now, addicted to opioids every day trying to get better. So the perspective I can give you, I'm on this task force and that bloody task force, and I work for this government, that government, who cares? I'm actually want to give you the street perspective, right? So what's happening on the streets of Ottawa with our community and why we're in such an opioid crisis right now. So I have access. I mean, the last time I was at a treatment center was yesterday morning. So you're getting real-time information. I get drugs given to me all the time for testing. So I actually know what's out there, what's being in everything. So you guys have that information. I have you for an hour. Let's have a nice, there's not a lot of people here. It's great. It could be a great unmute yourself, two-way conversation. Stop me at any time. Ask me a question. If you don't understand something or I'm speaking too fast because I'm a goofy newfie, then let me know and I will slow down and I'll reiterate it and make sure you guys understand the information because it's super important. Okay, so I'm going to share my screen and we'll get going here. Give me a thumbs up, Karina, that you can see my screens right on. Perfect. All right. Computer's slow. All right, here we go. Okay. So what are opioids? Why am I here? Why are we talking about opioids? It's the center of my life. So opioids are painkillers. I'm not here to tell you they're bad because opioids aren't bad. We can't do modern medicine without them. Where we mainly use opioids in modern medicine now is actually advanced cancer pain or anesthesiology. So putting people to sleep for surgery, basically is what we do. Famous names, hydromorphone, morphine, codeine, popular among student age and high school students, especially something called lean, or purple drank, which is actually codeine cough syrup mixed. I hear you shaking your head down there. That's awesome. Yeah. Codeine cough syrup mixed with alcohol. It's a bad combo, right? It's really popular now among high school students and it's terrifying for me. So we're currently developing a program with Rita Wood for high school students around lean. So it's nasty stuff. We've had lots of people overdose at a high school age, which is terrifying. So that's street opioids, basically. Now, what you need to realize is that though there are opioids, they are prescriptions prescribed to people. 75% of people who use an opioid illicitly got it from a prescription. Okay, so really, even though they're prescribed to people by medical professionals like physicians through pharmacies, just like that patch I dispense, people are actually using those to get high because they're diverted to the streets. Then there's a street source of fentanyl or opioids to add to this. The most famous street opioid of all time is heroin. H-Train, every gangster movie talks about heroin. Now, people on the street who use and inject opioids, they talk about heroin. They say, I'm on purple heroin, gold heroin, brown heroin, but they're not on heroin. Heroin doesn't really exist anymore. They call it heroin, but it's not heroin. It's actually all derivatives of fentanyl. Okay, so let's talk about the strengths. And I alluded to fentanyl earlier. Okay, so we have morphine. Morphine is a gold standard for opioids. Everyone gets morphine in a hospital. 100 times stronger than morphine is fentanyl. What do we use fentanyl for? Fentanyl is used in IV form to put you to sleep for surgery or as an epidural for childbirth, okay? So if you've ever been put to sleep for surgery, you use fentanyl, okay? But remember, the doctor says, count backwards from 10, 9, 8, you are out. That is an opioid overdose, okay? The study of anesthesiology, which is the study of putting people to sleep for surgery, is the study of putting someone in opiate overdose for surgery. That's what it is. Now, the anesthesiologists that work with us at our clinics don't like when I make it sound that simple, but ultimately that's exactly what it is. So keep that in the back of your mind when we talk about this. So 100 times stronger than morphine is fentanyl. There is another animal in Ottawa that is 100 times stronger than fentanyl, which is known as carfentanil. Carfentanil we use to sedate elephants for surgery. Okay, so 2-ton elephants, but yet people are using it on the streets. That's what it is. You guys will be getting this card in the mail. It says anything can be cut with fentanyl and carfentanil. Okay, so not only do we have an opioid crisis of people using opioids inappropriately in our streets, any drug that's illicit. So street marijuana, so not government supply, Molly, ecstasy, lean, crack, cocaine, fake anabolic steroids, you name it, it could be laced with fentanyl and carfentanil because they are more potent than ever and they could be cross-contaminate any drug. So not only do we have an opioid crisis with people who are actually using them, we have a non-opioid crisis with people who accidentally get a hold of them. So what is opioid overdose? So we just talked about it. Going to sleep for surgery. The doctor says, count backwards from 10, 9, 8, 7, you're out. Now, when you go out, a nurse rolls in or a doctor and says, open wide, and they stick a tube down your throat and hook you up to a ventilator. Okay? Why? You can't breathe during a surgery. Your breathing mechanisms are shut off. So essentially, an opiate overdose is you stop breathing. The mu receptors in the brain and spinal cord become saturated by the opioid. Breathing is depressed. The brain becomes hypoxic, which means no oxygen, and you die. From the time you take a hit till the time you're dead is 3 to 5 minutes. Most people die of an opiate overdose with sirens in the background and paramedics en route, right? The number one time for opiate overdose in Ottawa is Frost Week. Crazy. Emergency rooms are filled with people during Frost Week. So September, January. And that's because students are experimenting with drugs and alcohol and overdosing. Okay, this is what's happening. Lack of tolerance. Okay, this is Canada. If you don't know this is Canada, you are now removed from Algonquin College. I'm kidding. Now this is Canada. I don't have that power. Now, what this slide says is that in 2019, we lost 3,823 people to opioid overdose, roughly 1 every 2 hours. Okay. This stat is actually better than 2018. In 2018, we lost 4,400 people. Wow. Congratulations, Canada. Yeah, flatten the curve. Are you guys sick of hearing flatten the curve? Like it's something we talk about all the time, right? But we actually flattened the curve for opioid overdose. Now, but this is a staggering number here. From 2016 to 19, we lost over 15,000 Canadians to opioid overdose. It is the number one cause of accidental death among people your age. It is a massive problem. You're more likely to go to a funeral from an opioid overdose than a car accident. Okay, it is craziness. And the statistics are right there. Mainly, you know, you're at the one of the second or third highest risk factors, but really 30 to 39 is the highest, mainly males, right? And these are kind of statistics for medicine. Now, I did say that we flattened the curve. Congratulations, Ken, you did a pretty good job. Except for Ontario. Ontario is the only province that increased over 18. So now, Ontario is the epicenter of opiate overdose pretty much in the world. We are the Wuhan of opiate overdose, unfortunately. Okay, so like this is a massive problem. And here's what's really, really sad. In 2020, all the work we did from 18 to 19 to lower it and flatten the curve is gone due to COVID-19. COVID-19 has had an absolute disastrous effect on opioid crisis. So really, we have an opioid crisis, so an opioid epidemic, which means just in Canada, an opioid epidemic in the face of a global pandemic. We are expecting a 25 to 35% increase in opioid deaths in 2020, thus about 5,000. Sad. Fear, isolation, and money is the issue. So people are alone, they're afraid, and they have access to CERB, and this is why people are overdosing. I don't know about you guys, but during COVID-19, especially during the isolation phase, I drank too much beer, guaranteed. Mill Street Organic is my flavor. And I ate too much crappy food. Okay? We were bored. That's what we did. And I watched the rest of Game of Thrones. I think I watched the rest of Suits. You wouldn't believe the stuff I watched. It was crazy. I watched the whole thing of The Walking Dead. Okay, so I'm telling you, COVID has not been friendly to me. So my question to you is that if you had an opioid use disorder where you use opioids, what'd you do? Use more opioids, right? And the last statistic there is 1 in 3 is in the construction industry. It's been crazy. It's been a really, really nasty time. So I mentioned to you guys that in 2019, we did an overall pretty well at lowering the overdoses. And that was through massive naloxone distribution. Okay, so naloxone kits, overdose prevention kits. We gave out a ton of them. We saved many, many lives. And if you look at this slide here, it tells you that Ottawa was the best. So guys like Mark Barnes, Ottawa Public Health, all the angels out there, we did a wicked job. Okay, we had the highest naloxone kit distribution for opioid harm. Awesome. Don't believe the numbers. If you look at the numbers, it means I'm awesome. Congratulations, Mark. Pat myself on the back. But actually, it means bullshit. And the reason why it does is because when I asked the chief coroner in Ottawa, I'm like, hey, how often do you find naloxone at the scene of a death? And they told me only 1 in every 4 deaths you find naloxone. So if I'm the best in the whole world, actually, of distributing naloxone and getting it out there, I've given out thousands and thousands and thousands of kits, and I'm only getting 1 in 4 deaths, how many do we have to put out there? And that's the question I'll leave with you guys. A lot more. It's insane. So if I'm the best and I'm still crappy, then how bad is everybody else, right? And that's something to think about. Last thing I'll leave you with, when you talk about the magnitude of our opioid problem and where we're spending our money right now. We are spending billions on COVID-19. However, these are the deaths in British Columbia from COVID from January to June. Okay? Blue, COVID. Red, opioids. Where's our real problem? Where should we be putting our cash? Makes you wonder, right? And this is the last slide. This shows you ER visits for Ottawa. So Ottawa just tells you that the ER visits are now at a record high in the beginning of 2020, which means more people are making it to emergency departments in opioids related harms. Okay, that's awesome. People are making it because of naloxone. Okay, so now, I love Algonquin College. You guys are by far my favorite university. And I just talked about this, or college. I'm actually doing some training at Niagara, Loyalist, St. Lawrence. And I say, you guys got a lot of work to done to catch Algonquin. And then they all get pissed off. I don't care. So I tell them that because Algonquin students have gotten more naloxone training than any other faculty. And I've actually spoke to the president about this last year. Really wonderful, fantastic. So because I love you guys so much, everybody's getting this card today sent to them, okay? But on the back of it, it's an open book test. All the signs of symptoms of opioid overdose are on the back of it. So you don't have to take notes, just sit there and listen today and I'll go over it quickly with you. So I'm gonna talk about all the risk factors you see in the literature, boring books, those big medical books that make us nerds. And then I'm going to talk about actually what we see at treatment centers on the streets. And remember, for every 25 kits I've given out, 1 is used. So I've got tons of feedback about what people actually look like in an opiate overdose. Tons of feedback. And I've given out thousands, so I've had lots of people use them, okay? And Ottawa Public Health actually gets 2 calls per day of someone who saved someone with naloxone. Do you know how wonderful that is? That's awesome. I get these calls all the time. And I've had calls from students just like yourselves who save a life, which is pretty awesome. Okay, so the first sign and symptom of an opiate overdose is a decreased level of consciousness. Now that may be the stupidest thing I've ever heard written in the literature, because I want them to write down, they are ready for surgery. You got to think about them as completely unconscious. At safe consumption sites downtown, so at the Shepherds of Good Hope, at Sandy Hill Community Health Center, Clarence Street with the Public Health, and Somerset West, they all talk about what is the difference between someone who's comfortably high and someone who's an overdose. And the difference is their ability to respond to stimuli. Okay, so if they can't grunt, groan, put a finger up, tell you to F off, they're fine. If they can't do that, they're an overdose. Okay, and that's the difference. Completely unconscious. Guys will walk into my pharmacy and their faces are mangled, black eyes, broken nose. I'm like, dude, like what happened to you? And they're like, well, I went on the nod last night and the guys had to revive me with naloxone, which means they went on the nod and the guys started wailing on them to wake them up, and they didn't wake up. We don't recommend that medically. We stopped that last year. No more punching people in the face, okay? But what we want you to do, is that if someone's an overdose, they're not going to be able to go hear you. So you can't go, hey, Karina, are you okay? You know, or like, you know, Curly, are you okay? It's gonna be like, whoa, are you okay? You're gonna have to shake them because they're completely out. So that's how it works. So the first symptom, they're unconscious. You could kick them in the face, they won't wake up. Don't do that. Okay, the next symptom is pinpoint pupils. Now, I said it earlier, I just spent months watching The Walking Dead. Okay, the pinpoint pupils here, you look like a zombie. No joke. So all you can see is the color part of your eye. The black part, your pupil, is non-existent. Okay, so bright blue and green eyes, very distinctive. Very distinctive. You look like a zombie. Darker eyes, harder to tell, but still it's there. Okay, and in an overdose, sometimes the eyes are open, sometimes they're closed. You can see the pinpoint pupils. It's known as pinnies on the street. Then there's a deep snorting or gurgling sound. Again, Walking Dead. Okay, deep snorting or gurgling sound. This is the body gasping for air without the mechanical ability to breathe. Your parasympathetic nervous system is shut off. Same sound you would make if I took my hands, placed them around your neck, and choked you out, but there's no hands around your neck. In palliative care, when someone's dying of cancer, this is known as the death rattle. Okay, that's the sound you hear. Then your lips turn blue and your fingernails turn blue. Then your whole hands turn blue and your whole face turns blue. And the reason why is all the blood is being diverted from the periphery into the central organs to keep them alive. If you are Black, Indigenous, Northern Indigenous, it could be more of a gray color, not, you know, even Middle Eastern descent, more of a gray color. White guys, fair complexions, you know, blue eyes, red hair, you're going to see blue color. But dark complexion, you're going to see more of a gray color. Limp body, skip over that because that's stupid. You're ready for surgery. The next symptom that's listed in the monographs is vomiting. However, you do not have the muscular capacity to vomit. You can't puke everywhere because you've had too much opioids. So when I train 911 responders at call centers, it is actually foaming at the mouth. Okay, so it's a white kind of like cottage cheese stuff that comes out of your mouth. Hope you had your lunch already. I apologize for the descriptive, but that's what it looks like. It looks like cottage cheese. It's gross. Anyway, that's what it looks like. And it's like surfactant in the lung. You're gasping for air. That's the stuff that comes out. Then the last symptom on the left-hand side of your screen, which is not seen in a lot of literature, but it's in every single overdose, especially now because there's so much carfentanil and fentanyl in our neighborhoods, is this thing on the street we call the funky chicken, right? And what it is basically is this shaking. The body starts to shake and tremor. And actually it's a very ugly overdose because your body could be found with your jaw clenched and the carotid arteries pulsed and the muscles around the carotid artery are just spasmed because you lost oxygen so fast. That is all of them, all the signs and symptoms. Now, when I ask my boys on the street, I'm like, dude, what do you see? How'd you know to use Narcan last night on your bud? They'll say, Burnsy, it was 4 things. Pennies, blue lips, gurgle, chicken. They see those things, they know it's time for Narcan. Simple as that. So 4 things to remember. Now, I talked about risk factors on that big map of Canada. We talked about male, 30 to 39, blah, blah, blah. I can't stand medical risk factors because really, it will give you a false sense of security of someone who could overdose. Give you an example. If I was a young, rich, white girl who lived in a mansion in Canada, I don't fall in any of those risk factors. Yet, if I smoke a joint that's laced with fentanyl, I'm dead. Oh, it doesn't make sense. She wasn't in the risk factors. You see what I mean? So when I talk about risk factors, I like to talk about these ones you see on your screen right now. These are the street perspective risk factors. So I talk about it in terms of tolerance. If you have no tolerance to a drug, you will overdose. Give you an example. The first time you start drinking alcohol, you had a couple beers. You say, whoa, I feel very tipsy. I feel the effects of the alcohol more. As you drink more, you can handle a little 6-pack of beer or whatever, right? And that's because you've built up tolerance. Well, same goes for opioids. If you use opioids for 3 days, on day 4, you need more of the opioid to have the same effect as day 3. Tolerance. Guess who doesn't have tolerance? Somebody who thought they were doing a line of coke, but it was laced with fentanyl. Somebody who thought they were smoking a joint that was just weed and it was laced with fentanyl. A grandmother with her own prescription who had dementia, who hasn't taken it in 3 or 4 days and then takes her regular dose. A guy who uses heroin every day, goes to jail for 3 days, gets out and uses the same amount. This is all examples of overdose. And the scariest one, because we have opioids so much in our community, a baby who crawls across the floor and gets a hold of a sweet smelling tablet and puts it in his mouth, right? The answer is still naloxone all the time. But these are examples of loss of tolerance. If you have other medical problems, you're at more risk of an overdose. So if you're now a well person, you already have breathing difficulties, right? You're at more risk of an overdose because overdosing means you stop breathing. Now, what's happening in the world right now that affects breathing? Oh, I know, COVID-19, shocker, right? Or overdoses. Now, if you use alone as well and have no support around you, you're more risk of overdose. Now, what in the world are we asking people to kind of stay isolated and alone? COVID, right? As you can tell, COVID has been nasty on the risk factors for opioid overdose. You cannot use naloxone on yourself. You are ready for surgery. Thus, you will overdose. This is why using alone is such a risk factor. And then the last thing is, if you've had a previous overdose, if you have a buddy, a friend who's overdosed on any substance, their risk of overdosing, again, is almost guaranteed. And people are like, well, why is that, Mark? Why is it that someone who takes an opioid, overdoses, is embarrassed, requires medical intervention by paramedics, spends 2 days in ICU, probably has got cognitive brain dysfunction, will roll back on the street and use the same damn drug? That lends itself to opioid use disorder. People use opioids to kill pain. They're painkillers. People use opioids and abuse opioids to kill pain that's not just physical, but also mental. All drug use, usually, if you have a underlying medical health disorder or a mental health disorder, and you're using substances to cope, you will eventually use opioids. Because of all the drugs on the streets, opioids do the best job of turning off the brain from trauma. So if you've having flashbacks from a sexual assault as a kid, abandonment, rape, PTSD in the military from overseas work, the best drug at turning off the brain are opioids. They will describe the hit of the opioid as liquid caramel, a warm blanket, but more often than not, they describe that hit as a warm hug. Very powerful literature to describe how that drug makes them feel. And that's the feeling that I'm battling every day. It's try to get people not to want to turn to that hug and turn to other supports. The problem is where they feel no pain, where that hug is the tightest, is about 2 breaths per minute. They are almost dead. So if they go there once, they'll go there again and again and again until they get better. And most people use opioids 5 times a day. And it takes 15 years to get better. I have guys who have overdosed over 100 times before they get well. We need naloxone everywhere. And the drugs are stronger than ever. So this screen here tells you, this is LD50. So if you look at that ruler on the right-hand side, guys, that's 1 inch, right? See that? 1 inch. Give me a thumbs up, Karina, if you can see it. Right on. Okay, so now this is known as LD50. So this is lethal dose 50% of the time. So everyone on the call today took that much heroin, half of us would die. If everyone on the screen took that much fentanyl, half of us would die. If we all took that much carfentanil, which is in Ottawa, readily, half of us would die. So that is cross-contaminated and friggin' everything. By mistake. It's not drug dealers trying to prime people to get hooked on drugs. That's a big myth. I know lots of drug dealers. They're good guys. They really are. They're just making mistakes. This stuff gets into everything. So be careful. All right, enough doom and gloom. Christ, it's enough of that. Let's talk about this stuff right here. Narcan. So
we have a question.
Oh, go ahead. I'm not even looking at it.
What's the difference between codeine and fentanyl?
Oof, a lot. So codeine is very, very light. It's probably the lowest strength of all opioids. Okay. So much so that's over the counter in 8 milligram strength in Canada. Now we are only one of 2 countries in the world that has over the counter codeine, which I still think is stupid. But needless to say, it's pretty light. Fentanyl is probably, I think fentanyl's got to be 200 times stronger per milligram strength. But it's still a straight opioid. They're both opioids. Just that one is way stronger than the other. Okay. We measure fentanyl for human use in micrograms because it's so strong. And then carfentanil, again, is 1,000 times stronger than that. So we're looking at something that's about 10,000 times stronger than codeine, right? So carfentanil is an example, that little slide I showed you, is about 10,000 times stronger than codeine. As an example, roughly. Okay, so now we're back to naloxone. Okay, naloxone. This is Narcan nasal spray. This is the antidote for opiate overdose. So you got to think of this as the EpiPen for opiate overdose, except it's a spray. Okay, exact same thing. But like an EpiPen does not remove peanuts from the body. Well, this doesn't take the opioids out of the body either. So how it works is this. It goes into the lung. It just simply blocks the lung receptor, so removes the opioid off the lung for a short time to allow the body to breathe for just a short time until paramedics get there. It doesn't have the ability to dissolve it or clear it from the body. It just blocks at the receptor in the lung. So it only works for a short amount of time, but it reactivates breathing. Okay. Now it only takes 2 to 4 minutes to start working as well. Each nasal spray is only 1 dose, 1 shot, 1 prime, ready to rock and roll. Okay. There's a lot of people who are afraid to use this stuff, but you have to realize that it's completely safe. Okay. Completely safe. And these side effects don't really happen because our opioids now in our community are so strong that these side effects of withdrawal don't really happen. First of all, if there's no tolerance, there's no withdrawal. So in an accidental ingestion, there's no withdrawal. And because the opioids are so strong, they took too much of it. So they didn't take just enough dose, they took an overdose. So because the overdose is so large, again, no issues. Now, the literature also says this stuff only lasts for about an hour. I'm telling you that's BS. You're only getting 20 to 40 minutes out of a nasal spray before the person will slip back into overdose. Using this stuff is very easy. The person doesn't even have to be breathing for this to work. Okay, so it's a single-use nasal spray. The person doesn't have to even be breathing. It's amazing stuff, okay? Very easy to use. And like I said, it is completely safe. I can Narcan all you guys right now and nothing would happen. I've actually Narcan myself for my kids. Nothing happened. Fine. Besides, my wife called me an idiot. But that's normal. Okay. Now, how do we use this? Okay. So what I do now, I pause for a second from my slides, and I'm gonna watch. Oh, there's another chat there. What is this in there? Okay, there we go. I'm gonna actually share my video on my website, so you guys can see exactly how to use it. I think I'm gonna try.
Remember when it asks you to share computer audio.
I'll try my best. I'll try my best. As soon as I find it, that is. Sorry, guys. My bad. Here we go. I'm slow today. I have so much stuff open, I can't even find it. There we go. In 2018, 1 Canadian died every 2 hours from an opiate overdose, and this number continues to rise. It's not just heroin or fentanyl users in the streets, it's grandmothers with their own prescriptions, and kids who didn't even know they took an opioid. My name is Mark Barnes. I'm a pharmacist and the owner of NaloxoneCare.com, an interactive website designed to allow more Canadians access to life-saving drug naloxone. Naloxone is the drug that's found an easy-to-use Narcan nasal spray. It can reverse the effects of an opiate overdose in as quick as 2 to 3 minutes. After you complete a simple training and answer a few questions on this website, we can send you a Narcan nasal spray kit directly to your home. So what are opioids? They are painkillers such as codeine, morphine, OxyContin, Percocet, and fentanyl. Recently, much stronger powdered fentanyl and carfentanil are leading to accidental use and overdose because they are so small and hard to detect if mixed with other drugs. With this Narcan nasal spray antidote, you can deliver 2 milligrams of naloxone directly to the bloodstream. Although naloxone can reverse the effect of an opiate overdose, it cannot remove the opioids from the body. It's important to call 911 after you administer the spray because in 20 to 40 minutes, the effects of naloxone will wear off and the person will slip back into overdose. The time it takes when an opioid is ingested to overdosing and death can be as quick as 3 to 5 minutes, which is why it's so important to recognize the symptoms quickly. Here are the 4 major symptoms of an overdose. Unconsciousness. The person is not moving and cannot be woken up, even if you shake or pinch them. Pinpoint pupils. The person's pupils are small and hard to detect. Snorting or gurgling sounds. The person can be heard gurgling or choking, and breathing is shallow or undetectable. Blue and gray lips. The person's lips turns blue or gray. Other symptoms include cold, clammy skin, foaming at the mouth, and shaking. Every naloxone kit you order from naloxonecare.com includes a case, latex-free vinyl gloves, a CPR mask, 2 doses of Narcan nasal spray, an identification card letting everyone know that you've been trained to use naloxone, and instructions. We like the 5-step approach to respond to an opiate overdose. Step 1, shake and shout. Assess the person and remember the major symptoms of an overdose. Step 2, call 911. If the person is unresponsive, call 911 right away. Step 3, administer the naloxone. Lay the person on their back. Remove the device from the packaging. There's only 1 dose per device, which is ready to use, so do not test or prime the device. Tilt the person's head back and provide support under their neck with your hand. Gently insert the tip of the nozzle into the nostril. Your fingers should be right up against the nose. If giving to a child, make sure the nozzle seals the nostril. Press the plunger firmly with your thumb to give the dose. Remove the device from the nostril. Step 4, chest compressions. Start CPR as it takes 2 to 3 minutes for naloxone to start working. If you have an AED, use it. If not, push on the center of the chest. This pushes any of the oxygen left in the body to the brain and circulates naloxone to the areas of the brain and lung to start working. Step 5, is it working? If you do not hear a deep breath in 2 to 3 minutes, then go back to step 3 and administer a 2nd dose of Narcan nasal spray found in your kit. Once the naloxone is actively working and the person is breathing on their own, put them in the recovery position. The recovery position helps open the person's airways and avoids choking on vomit or spit.
Remember, naloxone only lasts 20 to 40 minutes, so an overdose can return. It's important to get the proper medical treatment. Tell paramedics everything you know about the situation so they can provide the best care. Get trained, get a kit, save a life.
Great. Okay, let's go quickly. There it is there. Narcan nasal spray. Step 1, call 911. Tell them where you are. Opiate overdose. Step 2, make sure that you know everything about it. Give them naloxone. Okay, simple as that. 911, naloxone. Your assessment is very, very quick. You know the 4 symptoms: pinpoint pupils, gurgling, blue lips, and shaking. Right? Getting 911 there now, we know is more important than ever. Just in case you're wrong, but also we can't stress enough that there's no breathing, no rescue breathing during COVID. It's also important. Public Health Canada wants to make that sure that everyone's aware of that. Even with the CPR barrier that's covering your naloxone kits, no breathing. So grab your nasal spray, place it in the nose. When you use a nasal spray, into the nostril towards the eye, twist. Simple as that. Okay, and then you spray it. When you spray, you'll see that it shoots about 2.5 feet in the air. Okay, so it coats the sinus. Now we want this to work in 2 minutes, not 4 minutes. You've given the dose, it's done. The plunger is gone. Open it up. You can see that it's been punctured, it's gone, it's done. So we start chest compressions. If you don't know CPR, don't be alarmed. Just push on the chest, hard and fast down the chest, okay? And that's what you need to do. If you have an AED, use it. The average call time for a paramedic in Ottawa is about 7 minutes, okay? So you're gonna push on that chest for 2 minutes, solid. 1 and 2 and 3. If they don't wake up in 2 minutes, you grab a second nasal spray that's in your kit and you give it again. It goes spray, 2 minutes chest compressions, spray, 2 minutes chest compressions until a paramedic tells you to stop. As simple as that. Now, there's something that we always miss in trainings that we need to talk about, and it's your own mental health. Step 6 is to get your own care. You've been through a traumatic event, right? Algonquin College has tons of resources, okay? And here's the deal. You've got Sarah Crawford's email address, and you can get in contact with all or all student services, okay, if there is a problem and or you need support after a traumatic event like this. And don't take it for granted. Do not take what you've been through for granted. There is lots of situations that will make you feel freaked out for days later, and you'll have flashbacks and dreams. And what I'm trying to prevent is future drug use, right? Let's face it, because some people who've been through traumatic events, unfortunately, have to use opioids to cope. We don't want that to happen to you. Okay, so important. That's the most important part. Now, getting naloxone. How do you get it in the community? Do I have to go to Algonquin College to get it? Do I have to be a student and go to a training? No, you don't. So I'll share my screen again to let you know that you can get naloxone easily. Most pharmacies across the country have a naloxone program, whether it be injectable or nasal. We're lucky in Ontario, ours is a nasal spray. So we can get a free nasal at many drugstores across Canada. In Ontario, there's a list at stopoverdoseottawa.ca, which is on the card I'm sending you. But to make it easier for you guys, because you're Algonquin students, you guys can get naloxone directly mailed to your house from me. You don't even have to go to a pharmacy, especially during COVID. No need. I can send them to you. You can email me directly at mbarnes@respectrx.ca, or you can go to my website, naloxonecare.com, and register as a user, watch the video I just showed you, and get a naloxone kit sent to you. Okay? So that's very, very important. There's the website there, naloxonecare.com. And the most important question I always leave with you guys before I take your questions is ask not why the addiction, but why the pain. Okay, thank you very much. Now, there is some time left for questions. We got lots of time left for questions. You have 19 more minutes before I'm off the clock and Sarah stops paying me. So, do you guys have any questions?
$0.
Exactly. Okay, I'll stop my share. That's stupid. Okay.
I think there's one thing that I want to talk about is like about how, because this was one of the things in the beginning that I was like, yeah, I don't know, about the contaminated drug supply. So like, can we talk about how it gets contaminated? Because I think that like that's one of the misconceptions a lot of folks have.
So everyone thinks, okay, so first of all, everyone thinks that, oh, they're trying to get me hooked on opioids. Not really. We don't have to get you hooked on opioids. It happens enough. Their market is pretty damn solid. It's like Apple, iPhone, and opioid drug sellers. They're both solid. Okay. There's huge markets right now in Canada for both. Here's the thing. With how small those drugs are, cross-contamination happens very easy. So give me examples. This is how it was described to me by a bunch of guys post-incarceration. Okay, they told me a bunch of stories. So on a big table, big coffee table, or big boardroom table, whatever, the guys are bagging weed. They got their Molly there. You know, they're making ecstasy. They're bagging up their coke there and weighing it. They got their down here, which is their fentanyl and whatever. And then there's a knock at the door. They're like, oh shit. They clear the table, put everything away, answer the door. It's all cool. Bring it back out. The down gets mixed in with everything because it's so small. They have to take those minute amounts and try to make a dose big enough to sell. So they mix it with inert stuff to try to sell it. So in that process, unfortunately, it's not even. We don't know how much is in what and where it goes. It's very, very hard to do. And these drugs aren't being mixed and made at Tunney's Pasture Health Canada labs with biochemists. I mean, they're made by guys who are half whacked in drug dens, right? Dimly lit. So unfortunately, that's what happens. That's the real story. It's accident. There's a little bit of priming in the sex industry with prostitutes, but not very much. The other thing is that this stuff is stable, frozen and thawed, because I heard in Canada it gets below zero. It's frozen and thawed for about 28 days. Okay. And then you have to replace it. I can send you 2 kits every single day you're alive. No problems. Everyone on the call today is getting a Naloxone kit for sure. You're getting 2 sent to your house by me. So when you get a strange FedEx package, it's not some weird gift from some telemarketer. It's from me. Okay. So don't refuse it. It's coming your way. That's why I need your address and your full mailing address and your phone number and email so I can actually send those kits to you. If you haven't given that information yet, make sure you get it to Sarah C. She's going to get it to me. That's how it works. It goes from Sarah C to me. Should be a saying. But anyway, that's how it works. And then I get you and I'll mail you out those kits. You'll also get those black cards. Now, if you want this conversation, this opioid lecture for class that you're in, first of all, if you're in the School of Protective Services, so you're getting one coming very soon, November 23rd. There's other ones coming out through Algonquin. Me and Sarah would like to do this once a week if we could. Like really, we think the message is so important. I can guarantee you there's been students at Algonquin who've overdosed and died. There's been students at Algonquin who've overdosed and lived, right? We want that to stop. We want this cycle to stop. So there's lots of resources out there. Make sure you check out my website for that as well. Sarah, anything else? Have I forgotten anything this time?
I don't think so. Oh, someone asked a question. Sorry.
Oh, cool.
Someone asked about the kits expiring.
Yeah, they expire. Yours expire, I think it'll be April 2022. That's if you keep them at room temperature. If they're not at room temperature, which is like +5 to +40, and they get frozen or in your backpack, they leave in your car, you leave them at your cottage, so that's really get baked, whatever. I don't care. Just you have to replace it every 28 days. And I can do that for you. Just email me. Say, Mark, I went through your most amazing training ever. You're awesome. Can I have 2? You don't have to say that. Just say ask for 2 more kits. I'll mail them out to you, right to your house. No problem.
Someone asked if fentanyl can be absorbed through the skin.
Good question. Everyone worries about the first responder risk. Okay, so here's the deal. There has been thousands and thousands of opioid overdose reversals with Narcan by bystanders. There's been 3 case reports of someone actually contaminating opioids, consuming opioids during that process. Of those 3, 1 got debunked because the guy was actually an opioid user. Okay, and the other 2, we don't know what happened. Okay, I think 1 was a SWAT guy, so obviously went to a drug den, so that's a little different. But overall, the risk is almost minute 0. You cannot absorb opioids to your skin. It takes a while. Give me an example. A fentanyl patch, that's a pharmaceutical patch designed to go through your skin, won't even go in there. It takes days. So, you know, it's not high risk. After saving someone's life, you are a superhero. Just wash your hands after. And something else we've talked about during COVID, wash your hands. Like, you know, that's all we do is wash your hands, right? Wash your hands after and you're good. Now, also, there has been no risk of overdose or contracting COVID by also saving somebody in opioid overdose who was positive. So someone could be opioid positive. They're not breathing. So guess what? They're not breathing on you, right? So simple. Give them a spray, push on their chest, walk away. You're cool. Go get tested, obviously, but you're cool.
And then, are there risks of exposure when responding to someone, and any best practices for that?
Best practices, it would be just to do everything I told you to do and wash your hands after.
Okay.
You're not breathing, remember? No breathing, just pushing on the chest.
I guess I feel like people are wondering, like, if you're gonna get close to them and there's like fentanyl, are you at risk of also?
Nope. Very, very low risk. Almost zero. I can't say zero because it's not zero, but it's like 1 in a million. Like if you go into overdose, when you wake up, go buy a lottery ticket and watch out for lightning.
But I also think it's too like important that this is why we're also calling 911. Like,
well, you are, but you're calling 911 for a couple of reasons. A, just in case you don't have enough naloxone. B, in case the guy bolts. C, maybe your own mental health. Like, we don't know, right? There's a whole bunch of reasons why you call 911. It may not work. You could be wrong. You always call 911. It's just what you do. It's the same as if you give an EpiPen. We let kids run around with EpiPen strapped to them. We still call 911, right? When you use an EpiPen, you still call 911. You use Naloxone nasal spray, you still call 911. It's not going to last forever. And people usually take about 2 days to get over an opioid overdose, right? Like it's about 2 to 3 days because opioids last so long.
Yeah. Carly, were you talking to us?
Well, I was just saying that that's crazy that it takes that long to actually start to happen, but it like happens so often, and it's like showing you how much people actually do it and how bad it really is.
It really is. It's crazy. I mean, if you think about it, okay, so if the city of Ottawa is only 1 million people and they're getting 2 calls a day of people who actually, use naloxone, it's nuts. We actually have the second, if not now, it might be, I think maybe in November or in October, it might have been the busiest safe consumption site in the country is in Ottawa. So I'll let you know that even though we are a government town, it's supposed to be all like sleepy Ottawa, BS, it is still a massive amount of opioids, right, being consumed and we are the epicenter of the world, right? So every other country looks to us for policy and development because no one else uses more opioids than us. Nobody.
One more question. How long does one dose last, and is it safe to give them another?
It's always safe to give them more. You can't give too much. It lasts 20 to 40 minutes.
But I think it's like important to note that, like, depending on, the dose of that people are having, like if someone ingested carfentanil, they might need 4, 5, 6, 10.
Well, I think the most I've seen that I heard is 12 nasal sprays to get someone to come back. Because remember, these drugs too are not just laced with opioids. They could be laced with other sleeping aids that can affect breathing. There's a whole bunch of reasons why you give a ton of naloxone, right? It's insane.
Again, it's like eating like sugar. Like it's not going to do anything bad to you, right?
No, it's completely inert. Like I said, I can Narcan myself right now, and nothing would happen. I've done it before, but it's like people. It's idiotic, probably. It's wasting a spray.
You don't need to do that every day.
No, I sprayed mine today, but look, mine was expired. I sprayed just to show you guys. So I expire once for training. I'm not wasting government money. You know how much these are each? $92 just for me to buy them per spray. So the government of Canada, government of Ontario thinks it's cheaper for all of you guys to have a naloxone nasal spray than to actually treat an overdose. To treat an overdose that spends a couple of days in ICU is about 17 grand. So $17,000 to treat an overdose, just one. And there is hundreds a day, right?
And death is expensive too.
Yeah, death's expensive too. So yeah, if you can't get behind the passionate, compassionate reasons to treat overdose, about letting people be alive to get that 15 years of therapy required to treat their trauma, like I get behind that because I just know their stories. I'm telling you, they don't have a chance from the start. Okay, I'm telling you, the stories are intense. But if you can't get behind that philanthropy that I'm behind, that I truly believe in, and you want to get behind the money in your taxpaying dollars, I don't care. I still win, right? It's cheaper to keep them alive. How's that? Whatever works. Whatever works for you to do it. Carry naloxone. So our messages to kids now are don't use alone, carry naloxone. Don't use alone, carry naloxone.